Hello everyone, welcome to Future Market Insights Think Tank series. Today we have gathered here to explore challenges, opportunities and recent developments for the telehealth market. We have expert panelists present over here. Let us begin with their introduction. We have Dr. Poonam Salve, Mr. Omkar Divakar and Ms. Prachi Singh. Thank you everyone for being here. So let us kickstart today's discussion with an overview of telehealth market. Coming to the Omkar first, would you please give us insights regarding the telehealth market?
Sure. So telehealth basically allows the healthcare professionals to examine as well as diagnose and create a treatment plan for a patient through remote monitoring. So the element of in-person visits is eliminated, and it has proven to be quite economical for the patient. And further, in terms of medical diagnostics, if a specialist's opinion is needed, the relevant data can be transmitted to the specialist, and further treatment plan can be decided. So broadly, the telehealth is divided into teleconsultation and remote patient monitoring. Teleconsultation is basically where live consultations are conducted with the patient. So let's take an example where the doctor is sitting in a city in his cabin, and the patient, due to some circumstances, cannot visit the hospital or is in a very rural, remote place. So live consultations can be conducted with specialists through teleconsultations. When it comes to remote patient monitoring, let's say a person with cardiac complications is needed to be monitored 24/7, and his vitals are to be monitored. So the doctor or the nurse or any other healthcare professionals who is responsible for monitoring can easily monitor the patient sitting at his desk or cabin, and the patient at his home. So a major boost, I'll say, that has affected the market is the COVID-19 pandemic. So due to which in-person visits were almost nullified, and this is when individuals as well as healthcare professionals adopted telehealth, wherein right from basics like through a call or through WhatsApp, consultations were being provided by the doctors for very basic ailments.
Thank you, Omkar. And also the relation between the EHR and telehealth seems to be very essential. So Poonam, would you please enlighten us about the key factors about the EHR?
Thank you for the question, Shantanu. Yes, technology has been growing immensely in this recent years. As technology has been incorporated into healthcare facilities, there has been quite improvement in the workflow, their accessibility and the availability of every single thing in the healthcare facility, which is very important for the patient's perspective as well as based on the healthcare professionals. So EHR and EMR systems have been recently been incorporated, or the adoption of EHR and EMR systems has been increased into healthcare facilities, which the reason being mostly is easy handling of documentation, easy data storage, and also streamlining the administrative processes as inflow and outflow of the patients in and out of the healthcare facility. Let it be anything, even healthcare hospitals or clinics or anything for that matter. The digital healthcare market has been growing immensely, which is why the EHR is also improving its technologies. And nowadays there has been things where healthcare facilities have been building up or changing their own pace or technologies, and they've been growing according as and how the technology is changed. So it is very important. The market of EHR and EMR, it has been growing at an average growth rate with a 5.2% CAGR, and the digital market, health market has been growing in billions. So for in coming years, the market is going to grow. Many regulatory bodies have been supporting healthcare information technology into healthcare. Patients have been the user interface which has been created for EHR and EMR portals have been very user friendly. The improvement in data analytics and AI incorporation has been very much good for the market.
Thank you, Poonam. Those were some wonderful numbers. Now coming back to Prachi, would you please tell us about the relation between the digital operating rooms with the telehealth industry or market?
Sure, Shantanu. I will be discussing about the digitalization in operation theatres. The integration of digital tools and technologies in the operation theatres has revolutionized the healthcare industry. Firstly, the use of 3D imaging. The doctors in the OT can use this 3D imaging to create a structured map of the internal organs of the human body. This enables the surgeons to navigate through the complex structures of the human body. Secondly, as Poonam correctly mentioned about the data that is currently available in the healthcare industry, the integration of this data with the AI can help the surgeon to navigate throughout the surgical process and store all the information. The third thing that we talk about is the use of robotic surgeries. The robotic surgeries in the healthcare industry has enabled the use of minimal invasive procedures. This allows the surgeon to correctly perform the surgery without the use of any external factors. We know that the amount of hospital-acquired infection tolls the hospital. The infection rates are gradually increasing. Hence, we can use the digitalization in healthcare with touchless sensors. These sensors in the OT can help the operation theatres to minimize the infection among itself. Lastly, I would like to mention that digitalization and operation theatres have been used to bring a seamless communication between the hospital healthcare staffs. This provides them to exchange the data and knowledge among themselves.
Thank you, Prachi, for shedding light on such a trending topic of digital healthcare. Now coming back to Omkar, would you please tell us about the integration of artificial intelligence into telehealth?
So thank you, Shantanu. So basically, there are three broad ways that AI can be integrated into telehealth. First is the decision support. Second, natural language processing, and third, chatbots or virtual assistants. So in decision support, the AI system is trained in such a way that it can analyze various previous patient records as well as the current patient history, the current diagnostic images provided, and suggest the healthcare professional a treatment plan or a diagnosis, a possible diagnosis that can be made. Secondly, natural language processing helps the AI system to comprehend and recognize the teleconsultation that is going on between the doctor and the patient, wherein a medical transcription can be created, and this will help the doctor in going through the transcription post the teleconsultation in case of any pointer or any ailment that the patient has mentioned but the doctor has missed out on. Thirdly, we come to chatbots or virtual assistants. So a good example of chatbots or virtual assistants is the Arogya Setu app, which was created by the Government of India. And it was a very preliminary version, but it helped to give FAQs about a specific ailment, in this case of COVID-19. So, and also based on very basic parameters, a very basic diagnosis can be made, which can determine or help in determine the urgency of a specific case, as well as it is very essential tool when it comes to healthcare education and awareness.
Thank you, Omkar. Now to Poonam, I want to ask about what are the possible challenges related to implementation and adoption of EHR.
Thank you, Shantanu, for the questions. Yes, in spite of all the increase in digitalization, telehealth, AI and data analytics, the market is booming, yet the market also comes with a few of challenges which are caused, like secondary. Implementing EHR or EMR into healthcare facilities is very easy and affordable for secondary as well as tertiary level hospitals, but it is very difficult for the rural hospitals or primary healthcare centers to incorporate all the technologies in the healthcare building, which hinders the market growth. Again, the user interfaces, data-driven technology has to be very patient-friendly. Also, workflow management, as and how any new technology has been incorporated into any facility, it is very difficult for the healthcare workers or the people working into operations. It's very difficult for them to get used to the technology, which again can hinder the growth, not at a greater extent, but on a temporary level. Yes, the EHR and EMR systems are supposed to be HIPAA compliant, that is a Health Insurance Profitability and Accountability Act, which is very much needed. Improving quality healthcare and providing better health for the patient is very much important. So, addressing these challenges can bring a smooth, streamlined process in the operations into healthcare facilities, which can further boost the market growth in the coming years.
Thank you, Poonam. Now coming back again to Prachi, what are your views regarding digital therapeutics industry?
Sure. Now, digital therapeutics is the use of software-based intervention to treat, manage the patients during the stay in the hospital or anywhere. Some of the trends that include in digital therapeutics includes the conversions of digital therapeutics and technology with the healthcare industry. Now the startups and the technology companies are utilizing these advantages and coming up with different healthcare applications. As Omkar currently mentioned about the telehealth and tele application or chatbots that can be used for communication between the patient and the doctor. Secondly, the digital therapeutics offers a low cost approach when we compare to the R&D cost that is associated with the product development that the company spends, a life science company or the medical device company spends on its R&D and product development. As we know, the traditional medicines have always been fall short to meet the patient needs. Here comes the digital medicine, where it can basically fulfill the patient needs and give a better approach for the treatment. In conclusion, the digital therapeutics offers a lucrative opportunity for the digital health market. This is due to conversions of medical technology, mobile technology, its ability to meet the unmet patient's need, low-cost R&D for product differentiation. Together, with the help of technology and healthcare, we can bring in more personalized and medical intervention in the healthcare industry. Thank you.
Thank you, Prachi. Thank you everyone for being part of this discussion. So as we conclude, we have learned about the challenges, latest trends and developments in digital health industry. Thank you.